A father pleads for his young daughter's life to New Jersey Governor Christie. The father's talking about his 2-year-old daughter, Vivian. Here she is on the couch, playing with her mom and sister. Vivian suffers from what's called Dravet syndrome. It's a severe form of epilepsy that causes seizures. And we need to warn you, we're about to show you what it's like for Vivian to experience these seizures, and that may be difficult to watch. She experiences these types of seizures on average every 4 days. She sleeps with a heart and oxygen monitor, and she wears an eye patch because looking at certain patterns brings on more seizures. She's on a diet that helps and a couple medications, but it's clearly not enough. She's already suffering developmental issues and has the functioning ability of a 1-year-old. Her parents want to give her a form of medical marijuana which has decreased seizures for other children. Vivian's parents have lobbied state legislators in New Jersey, but the bill has been sitting on Governor Christie's desk for nearly 2 months. So Vivian's dad, as any dad would, Brian Wilson, he decided to ask Governor Christie about it face-to-face during a campaign stop yesterday.
These are complicated issues.
Very simple issue.
Listen, no, I know you think it's simple, and it's not.
We've had experts. Have you?
I know you think it's simple, and it's not.
Please don't let my daughter die, Governor.
Governor Christie said he will make his decision on whether to sign or veto the bill tomorrow. Vivian's father, Brian Wilson, joins me now from Beach Haven, New Jersey. Brian, thank you so much for joining us. First of all, I'm sure I speak for all of our viewers that our hearts go out to you. Talk to us first about Vivian and the struggle she faces with Dravet syndrome.
Well, you know, every day is a struggle with Vivian, not knowing what type of seizure she's going to be facing that day, if she's going to have one that sends her to the hospital, wondering what our day is going to be like. Are we going to be, calling 911? Are we going to be just having a fine day? In general, her day is sitting in the house all day, though. We don't go out. We don't do things with her. She doesn't do things with her sister because there are just too many things in the natural environments that can trigger seizures for her. So it's just kind of her sitting around around the house, and we try to entertain her as much as we can and keep her as happy as we can. But it's just kind of, always sitting and waiting for the next one.
Explain to us what you meant when you said, please don't let my daughter die, Governor. If she does not get this THC, this medical marijuana, it's a strain that's low in THC, I should make sure to note. Would that save her life? Why do you say this is a life and death issue?
Well, with Dravet syndrome and all forms of severe epilepsy, these seizures can be life-ending. They're extremely taxing on your heart, on your respiratory system, on your brain. Vivian has stopped breathing twice during the course of extended seizures. She has seizures that would last sometimes 45 to 60 minutes, like the kind you saw in the video. So she's undergoing a lot of physical duress because of this. She's being mentally, her development is slowed down. And additionally, children with Dravet syndrome have an increased risk of SUDEP, which is sudden unexplained death of epilepsy patients. No one quite knows the reason why that occurs, but it's another one of the risk factors in this. And without us being able to control her seizures and pulling her out of that zone of constant seizure activity in the brain, she's constantly at risk. As I said, she stopped breathing twice and had to be resuscitated during seizures at times. So her life is at risk every day, and kids die all the time from this. There was a 4-week period in April where 4 children with Dravet syndrome died. So it's one of the realities we face unless we can get these under control.
So, Brian, it seemed like a kind of a tense conversation between you and Governor Christie. I mean, obviously, I've seen worse, but what was your impression of your conversation with the governor? Do you think he heard you? Do you think he listened to you?
I don't really think he particularly listened to me. I mean, I knew going in that he had no desire to talk to us. We tried to arrange some conversations with him ahead of time. We called the office. We tried calling. We tried setting up an appointment. So based on the conversation and the way he tried to get past me right away, I kind of knew he didn't want to have this conversation with me in the public forum. And that's again why we tried having conversations with him not in the public forum earlier. This way we can have a real conversation. But we were kind of left with the last few days. We're coming down to the wire. He was in my hometown, and I had to go talk to him and try to convince him to sign this.
I want to now bring in our CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay, you profiled an almost identical case to this in your documentary, Weed, which is going to run again, and we'll promo that in a second. But in your documentary, you talked about a 6-year-old girl with Dravet syndrome, and her parents saw a vast improvement with this strain of medical marijuana. Vivian, however, is 2, not 6. Is there a difference? Is there any research on the difference that it might have, the different effect it might have on a 2-year-old versus somebody a little bit older?
Well, I don't think so. I don't think there's a lot of research in that area. And I think, frankly, the Figgies, the parents of Charlotte, if they could have made this happen and actually gotten her the marijuana earlier or learned about the marijuana earlier, they probably would have given it to her earlier as well. As Brian pointed out, I mean, you know, there's not a lot of options here. So, you know, we do think about the brain development, and people's brains develop certainly as children all the way up into the mid-20s, and you want to be more judicious, obviously, in those situations. But here, you know, I know in Charlotte's case, I'm not sure how it is with Vivian, but Charlotte was on 7 different medications at one time, Jake, and they were even thinking about compounding a veterinary medication because they had run out of options. There aren't a lot of studies specifically on Dravet syndrome. There are studies looking at seizure disorders overall and the use of cannabis specifically. But again, you know, this is one of those situations where we know what the options are, and none of them really work, besides high CBD cannabis.
And Brian, I want to close it with you. Obviously, first of all, just for our viewers, we're not talking about smoking marijuana. We're talking about lozenges and other edible forms of marijuana.
Right.
Brian, what will you do if Governor Christie vetoes this bill, doesn't sign the bill tomorrow?
Well, you know, we're kind of prepared for that. We've already started looking into neighborhoods to move in Colorado. You know, we really don't have a choice except for to leave our family, friends, you know, grandparents, leave everything we've known and grown up with, and have to vacate our state and be kind of run out of town, if you will. You know, it's either that or stay in New Jersey and continue to suffer. So we're really looking at the truly compassionate states that are, you know, medically advanced in this and weighing our options of leaving, especially if this doesn't pass through.
All right, Brian Wilson, thank you so much for joining us. Our thoughts are with you and your family and, of course, your daughter Vivian. And thank you, Dr. Sanjay Gupta.